C1 to C2, it's the C1-C2 caliper I'm doing, motion palpation, right? And it's only a 15-degree wiggle. So if you find it right there, and there, it's that caliper I'm looking for to open, okay? That's C1 to C2, rotary. And if I do C1 to occiput, it's that anterior space in front of the TVP, and you rotate away, and that little space should open, okay? So there's two motion palpations for Atlas rotaries. One's to occiput, and one's to C2. Make sure you're clear on that, right? Okay, so because I did a setup on you last week, if anyone else wants to volunteer with maybe, not to say you don't have beautiful hair, but so they can see the neck clearly, I'm going to pick on you, unless it's somebody else who wants to volunteer.
Motion?
Anyone? I don't have to cavitate. And then you can lie down for me. Fine. So again, what I'm doing on Atlas is very similar to what you did last week, C2 to C7 rotaries. The only difference is you have two choices now. One's relative to C2, which makes it anything from C1 to C7 as a superior line of drive, meaning you're stepping down to the elbow. You're next to the patient, keeping the head close to your body, and your line of drive, your body, your ASIS, your elbow, the way your arm is, it's inferior to your contact, making it a superior line of drive for rotation. If it's C1 to occiput, so upwards, you stay up. You stay cephalad, head of top of the headrest, and you don't take this major step down here. So this way, you have the inferior line of drive. It's already there as soon as you contact the patient. That's the line of drive you have to maintain, and then you're going to rotate to the shoulder here. Otherwise, it's the same. And it's all related to what we did last week, C2 to C7. Major difference is the motion palpation is different, so know it really well. And also remember that C2 to C7, pillar contact. C1, Atlas, arches. They're thin bone. It's not going to feel the same. It's this muscle. The arch is deep to there, and there's probably hypertonicity underneath the occiput there. But to know that you're on C1 and not C2, first of all, if you're on C2, you're going to feel more of a pillar contact. There's a different feel to it. And secondly, if this is the rim of the occiput, I'm sliding below it, so that part of my finger is contacting the inferior aspect of that rim. So I can traction on that afterwards at the end of the adjustment, a little bit of traction. So you need to, that's the occiput here, you're coming in here where the posterior arches are. And that's the rim. Otherwise it's the same. So a different hand takes in there, and you get to slide into that. Right? If your thumb's there's a good chance you're palming up. You don't want that. You want to be like that, and you take advantage of the range of motion in your wrist. So slide in. So C1 rotary to C2, it's like the rest of it from last week. So I'm going to step down low, get the head close to my body. It's not maximal ear to shoulder, it's just a lateral tilt. Induce a C curvature laterally on the C spine, and then rotation, like that. And that went.
Nice.
Even though I didn't try. I didn't assess if he needed it, so what? Cavitated doesn't mean that's what he needs today. And if it was a C1 to occiput, I don't step down. Everything else will be the same. So I'll do it on this, this side, so you can compare and contrast, I guess. Same contact, your lobe, right? I'm not going to do this, not even a little bit, because I don't want a horizontal line of drive. I want this line of drive here. So what I do, I'm going to lateral flex towards the contact a little bit, do some rotation, start making things tight, right? I'm going to tilt the head towards the clavicle, the chin towards the clavicle. Okay, so let's do this again.
Which one's that again?
C1 occiput, rotary index. It's on the same page, I believe. You have two options for line of drive there. So you're going to rotate, chin tuck, so it's like this, and then you can finish a rotation there. Something like this, okay? Towards there. It's nice if they need it. Rotation, chin tuck, and a line of drive like that. Okay? That's it. So try those.
Sideways line of drive?
And his chin is tucking towards the clavicle. And then I'm going to finish with a rotation from up here.
That's all we're doing today, right?
No, that's not all. That's only 2 of 6.
Great. Serious?
Yeah, we're going to do laterals up here next, and then occiput. But the good thing is, it's all based on what you did last week. So now you get to practice atlas rotaries. And I would suggest you leave the inferior line of drive out right now and do C1 to C2 and practice your C2 to C7. It's all the same practicing out. It's just different contacts and different motion palpations. Once you get that down, then try the inferior line of drive as a next challenge for you. But it's set up only on the exam. You have time to master that one.
I think generally most of us like to learn what the method that you, or the adjustment that you feel like is best. You know,
no,
like,
you don't have a
like
choice. That's a totally different move for a totally different fixation. What do you mean?
That one that only has one.
Which one is that? Shut that off for a second.